Nebivolol, also known as Bystolic, is a medication used to treat high blood pressure. By lowering high blood pressure, it helps prevent strokes, heart attacks, and kidney problems. This medication belongs to a class of drugs called beta blockers, and it works by blocking the action of certain natural substances in the body, such as epinephrine, on the heart and blood vessels. This lowers heart rate, blood pressure, and strain on the heart. It is important to take Bystolic exactly as prescribed by your doctor, and the typical starting dose is 5 mg once daily. It can be taken with or without food, but it is important to take it at the same time each day. Always follow your doctor's instructions for the best results. Before you start taking Bystolic, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, it's important to ask your doctor or pharmacist for clarification. You can take Bystolic by mouth with or without food, as directed by your doctor, usually once daily. The dosage will depend on your medical condition and your response to the treatment. To get the most benefit from Bystolic, it's important to use it regularly. Try to take it at the same time each day to help you remember. It may take several weeks before you start feeling the full benefits of this medication. Even if you start feeling well, it's important to keep taking Bystolic as prescribed. If you have high blood pressure, you may not feel sick, so it's important to keep track of your blood pressure readings. If you don't see any improvement or if your blood pressure remains high or increases, make sure to inform your doctor. Common side effects of Bystolic may include headache, dizziness, lightheadedness, tiredness, nausea, slow heartbeat, or trouble sleeping. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. To minimize the risk of dizziness and lightheadedness, make sure to get up slowly when transitioning from a sitting or lying position. This medication may reduce blood flow to your hands and feet, leading to a sensation of coldness. Smoking can exacerbate this effect, so it's important to dress warmly and avoid tobacco use. It's important to remember that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as blue fingers or toes, fainting, very slow heartbeat, new or worsening symptoms of heart failure, such as shortness of breath, swelling ankles or feet, unusual tiredness, sudden weight gain, or mental/mood changes, such as confusion, mood swings, depression. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed above, contact your doctor or pharmacist for advice. For residents of the U.S., you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. For residents of Canada, you may report side effects to Health Canada at 1-866-234-2345. It's important to not stop taking Bystolic without consulting your doctor first. Suddenly stopping this medication can worsen some conditions and may cause chest pain, heart attack, or irregular heartbeat. If your doctor decides you should stop taking Bystolic, they may direct you to gradually decrease your dose over 1 to 2 weeks. When you're gradually stopping Bystolic, it's recommended to temporarily limit physical activity to reduce strain on the heart. If you experience chest pain, tightness, pressure, or spreading to the jaw, neck, or arm, unusual sweating, trouble breathing, or fast/irregular heartbeat, seek medical help right away. As for the daily dosage and optimal timing, it's important to follow your doctor's instructions. They will determine the best dosage for you and the optimal time for taking Bystolic. Before starting Bystolic, it's important to let your doctor know if you have any allergies or if you've had any problems with certain heart rhythm issues, blood circulation problems, breathing problems, kidney or liver disease, mental/mood disorders, muscle disease, overactive thyroid disease, serious allergic reactions, or surgery planned. When taking Bystolic, be cautious when consuming alcohol or marijuana as it can increase dizziness. It's important to avoid driving or using machinery until you know how this medication affects you. If you are a marijuana user, be sure to discuss this with your doctor. If you have diabetes, Bystolic may affect your blood sugar levels. Be sure to monitor your blood sugar levels regularly and report any symptoms of high blood sugar to your doctor right away. This is especially important for children who may be at a greater risk of low blood sugar while using this medication. If you are pregnant, discuss with your doctor the risks and benefits of using Bystolic. It may be used during pregnancy if clearly needed, but it may have effects on the baby such as low birth weight and require close monitoring. If you are breastfeeding, consult your doctor before continuing to breastfeed while taking Bystolic. It's important to be aware of any potential drug interactions with Bystolic, as they can affect how the medication works and may increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Bystolic is fingolimod. Additionally, some products may contain ingredients that could raise your heart rate or blood pressure. Be sure to inform your pharmacist about all the products you are using, and ask them how to use them safely. This is especially important for cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. Always consult with your healthcare provider before making any changes to your medication routine. If someone takes too much Bystolic and experiences severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include an unusually slow heartbeat and fainting. It's important not to share Bystolic with others as it is prescribed for your specific condition. It's recommended to talk to your doctor about making lifestyle changes that may help Bystolic work better, such as stress reduction programs, exercise, and dietary changes. Make sure to regularly check your blood pressure and heart rate while taking Bystolic. Your doctor can show you how to do this at home, and it's important to share the results with them. The daily dosage and optimal timing for Bystolic will be determined by your doctor based on your individual condition and needs. If you forget to take a dose of Bystolic, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take double the dose to make up for the missed one. Remember to store Bystolic at room temperature, away from light and moisture. It's important not to keep it in the bathroom, and always keep it out of the reach of children and pets. When it comes to disposing of Bystolic, make sure to do so properly by consulting your pharmacist or local waste disposal company. And as always, don't flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to discard the product and it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.